Guaifenesin is used to treat coughs and congestion caused by the common cold, bronchitis, and other breathing illnesses. This product is usually not used for ongoing cough from smoking or long-term breathing problems unless directed by your doctor. Guaifenesin is an expectorant, which means it works by thinning and loosening mucus in the airways, clearing congestion, and making breathing easier. It's important to read the package instructions carefully before using this product, especially if you are self-treating. Cough and cold products have not been shown to be safe or effective in children younger than 6 years, so it's important to consult with a doctor before giving it to children. It's also important to carefully follow all dosage directions and not to give other cough and cold medications that might contain the same or similar ingredients. Ask a doctor or pharmacist for more details about using the product safely. Remember, these products do not cure or shorten the length of the common cold. To relieve cough and cold symptoms, consider drinking enough fluids, using a humidifier, or using saline nose drops or spray. When taking this medication, it's important to follow the instructions given by your doctor. You can take it with or without food, usually every 4 hours. If you are self-treating, make sure to carefully follow the directions on the product package. Guaifenesin may have a bitter taste, so make sure not to split the tablets unless instructed by your doctor or pharmacist. If you are using the liquid form, be sure to measure the dose accurately using a special measuring device/spoon, not a household spoon. The dosage of this medication is based on your age, medical condition, and how you respond to treatment. It's important not to take more than 6 doses in a day, and not to increase your dose or take it more often than directed. It's also important to drink plenty of fluids while taking this medication, as it will help to break up mucus and clear congestion. If your cough is accompanied by a persistent headache, fever, severe sore throat, rash, or if it lasts, returns, or gets worse after 7 days, be sure to consult your doctor. These may be signs of a serious medical problem, and you should seek medical help right away if you think you may have a serious medical issue. If you experience nausea or vomiting, it's important to let your doctor or pharmacist know. However, many people using this medication do not have serious side effects. It's rare, but if you notice symptoms of a serious allergic reaction such as rash, swelling, severe dizziness, or trouble breathing, seek medical help immediately. There may be other side effects not listed here, so it's important to contact your doctor or pharmacist if you notice any unusual effects. Remember to follow your doctor's instructions on when and how to take this medication. Before taking this medication, it's important to talk to your doctor or pharmacist about any allergies you may have. This product may contain ingredients that can cause allergic reactions, so it's crucial to discuss this with your healthcare provider. If you have a history of breathing problems or cough with blood or large amounts of mucus, it's important to inform your doctor or pharmacist about your medical history before using this medication. Liquid forms of this medication may contain sugar and/or alcohol, so if you have diabetes, liver disease, or any other condition that requires you to limit or avoid these substances, it's essential to seek advice from your doctor or pharmacist. It's also important to note that the liquid forms and powder packets of this medication may contain aspartame. If you have phenylketonuria, PKU, or any other condition that requires you to restrict your intake of aspartame, it's important to consult your doctor or pharmacist before using this product. Before undergoing surgery, it's important to inform your doctor or dentist about all the products you use, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant, it's important to discuss the risks and benefits of using this medication with your doctor. And if you are breastfeeding, it's crucial to consult your doctor before using this medication, as it is unknown if guaifenesin passes into breast milk. When taking expectorant, it's important to be aware of potential drug interactions. This means that the way your medications work could be affected, or you could be at a higher risk for serious side effects. It's essential to keep a list of all the products you use, including both prescription and non-prescription drugs, as well as herbal products, and share this with your doctor and pharmacist. Do not make any changes to your medication dosage without consulting your doctor first. It's also crucial to check the labels of all your medications to ensure that you are not taking more than one product containing guaifenesin, the active ingredient in expectorants. Additionally, it's important to note that this medication may interfere with certain lab tests, potentially leading to false test results. Make sure to inform lab personnel and all your doctors that you are using this medication. If you or someone else has taken too much of this medication and is experiencing severe symptoms like fainting or difficulty breathing, seek immediate medical attention by calling 911. Alternatively, contact your local poison control center for assistance. In the U.S., you can reach out to the National Poison Control Center at 1-800-222-1222, and in Canada, contact your provincial poison control center. If your doctor has prescribed expectorant for you, it's important to follow their instructions and not share the medication with others. It's also important to keep all medical and lab appointments while taking this medication. Remember that expectorant is only for temporary use, and you should not take it for more than 7 days unless your doctor instructs you to do so. If your condition lasts longer than 7 days, be sure to inform your doctor. If you happen to forget to take a dose of expectorant, take it as soon as you remember. However, if it's almost time for your next dose, just skip the missed one and continue with your regular dosing schedule. Avoid taking a double dose to make up for the missed one. When it comes to using expectorants, it's important to store them at room temperature, away from light and moisture. You should also avoid storing them in the bathroom and refrain from freezing the liquid forms of this medication. Different brands may have different storage needs, so be sure to check the product package for specific instructions or ask your pharmacist for guidance. And as with all medications, it's crucial to keep them out of reach of children and pets. When it comes to disposing of expectorants, it's essential not to flush them down the toilet or pour them into a drain unless instructed to do so. Instead, properly discard the product when it's expired or no longer needed. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the US, you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.